Right now, let's hear from the Health Minister, Minister for Primary Care, Maria Caulfield, who is also a nurse. I caught up with her earlier and started by asking what she thought the pressures were that GPs currently face.
It's a really busy time for GPs. I've been out visiting my GPs in my own constituency, but also talking to GPs more widely and talking to MPs cross-party from around the country. And they describe it like a tsunami. So people didn't go and see their GPs during COVID for a variety of reasons. Nervous to go to GP practices. Obviously, there's infection control measures. And so that it was difficult sometimes to get a physical appointment at GPs during the pandemic. But since then, there's a wave of people who needed to be seen sooner but are just coming forward now. They're also experiencing a huge amount of patients who are waiting for hospital treatments and contact the GPs to see what's happening and to try and find out information. So there's a range of different issues that GPs are finding, but their workload is absolutely huge at the moment.
And whose fault's that?
I don't think it's a fault. I think, we're still in the midst of a pandemic. And so there are more reasons to call your GP than there were, say, pre-pandemic. Patients have, not been able to get elective care a lot of the time during the last 18 months, and that's reopening now. And so they're coming forward if they've had, say, a hip problem that they, need to see an orthopaedic surgeon for. They put that off during the pandemic. Some people had symptoms and thought, they're not too serious. I'll wait till things calm down. And we're heading into the winter period as well. So naturally, it's always a busier time with respiratory illnesses, coughs and colds that people go and see their GPs for. So I think it's almost like a perfect storm.
And how do you go about fixing this problem? Because obviously training up a new GP takes many years. And so to get new GPs into the system right now just isn't possible, is it?
Well, there's two things we're doing. Obviously, we are training more GPs, and we've had, really good numbers coming forward for GP training in the last year, which is really encouraging. But as you say, they take a while to train. But the two things I would say is, firstly, the GP winter support package is there to really help practices try and open up their options for patients. So, yes, for more face-to-face appointments, but also to try and tackle some of the issues of patients trying to get through to receptionists where they have maybe one or two receptionists. Offering them that cloud-based telephony system will really make a big difference. Enabling them to access that funding to open up other healthcare professionals who work in primary care at those GP practices. So, being able to take on more hours from a pharmacist, a physio, a nurse, a paramedic, means that more patients can be seen. It doesn't always have to be the GP that a patient sees. I say this as a nurse, if you've got high blood pressure, you're probably better off seeing the practice nurse who can do your blood pressure readings for you and give you advice, or the pharmacist or the paramedic. We have to kind of view general practice a bit like a hospital. There's a range of healthcare professionals there that can see you. And so if our only focus is on how many GPs we've got, we really do miss the expertise and the skills of other healthcare professionals who can provide really good quality services.
Are you concerned about the number of appointments still happening not face-to-face? I mean, there's lots of anecdotal evidence that people aren't getting, everything diagnosed in the way they should have done. It's very difficult over the phone unless it's very straightforward. Healthcare is complicated, and sometimes it's only when you sit in front of a medical professional, they can pick up actually what the issue is. Are you concerned that still too many appointments are happening not face-to-face?
Well, I think it's about choice. So I've heard from lots of patients that actually they do enjoy the telephone or virtual consultation. If you speak to some particularly younger patients who maybe have sometimes simpler requests around prescriptions or advice on issues that can be done over the phone. If they're busy trying to juggle family life, trying to get to work, the telephone appointment system really works for them. But for those who do need face-to-face and want face-to-face, we have seen an increase. So during the pandemic, I think face-to-face appointments with GPs were down to 43%, understandably so. They're now, close to 60%. So we are definitely seeing an increase in numbers.
I wanted to ask you about this report published by the Social Market Foundation that I think was written by a former secretary of the Medical Practices Committee, a guy called John Goodham, looking at the idea of reinstating sort of central control over where GPs can and can't go. The idea of barring GPs from taking new jobs in affluent areas to force them to work in the sort of deprived towns where they really need them. And actually, the figures are really striking, aren't they, in terms of the number of people per GP. In some of the best areas, it's 1,600, 1,700 patients per GP. In other poor areas, it's sort of 2,000 going on for 3,000 people, or almost double the amount. Is this something that you're looking at to try and get new GPs into the areas that really need them?
Yeah, so the government has been doing this for a while now. We've got the Targeted Enhanced Recruitment Scheme, which is a scheme that offers GP trainees £20,000 to train in an area where there are less doctors, so an under-doctored area, as they're called. And what we've found is that where trainees go to train, they'll often stay. And so incentivising them to go to areas where there are less doctors and doing their training there means that once they are trained, they're likely to stay there. And we've seen, numbers have gone up, and we had, 500 in the last year take up that offer. So I'd rather incentivise GPs to go to areas where there's a shortage rather than mandate them to do so. Just finally,
Maria Caulfield, you mentioned that you were a nurse, and actually you went back working on the front line of nursing during the coronavirus, the early stage of the coronavirus pandemic last year. There's been lots of talk over the last few days about second jobs of MPs and that sort of thing. Presumably you would draw a very distinct difference between what you were doing on the front line in the NHS and, somebody who's lobbying or consulting and that sort of thing. Would you like to still be able to do... I know you've said you've got two jobs now, you're an MP and a minister, but would you still like to keep that ability to go and work on the front line in the NHS to really know what's going on there while also still being an MP?
Yeah, no, absolutely. I think, certainly for me, just seeing what's happening on the front line, I did a night shift on Saturday night, actually, seeing what's happening on the front line, it just gives you a different perspective that you can't learn from briefings or meetings, or certainly not in the Westminster bubble. And, people have talked for years about they don't want professional politicians, they want people with real life experience coming into Westminster and making decisions. And I think for me, being able to my experience of working on the COVID wards during the pandemic, will stay with me forever. And certainly I'd be, I think, a poorer minister if I hadn't done that.
And what was it like, Saturday night shift in the NHS at the weekend?
Yeah, it was busy. We had, there was it was a busy shift, and with poorly patients. But actually, the staff were working really well. We had some empty beds, and we had all the kind of resources we needed. So it was just interesting to kind of, to keep that. I would really like to keep doing that because, for me, I enjoy being 12 hours out of not being an MP and no one being able to get a hold of you. And actually people were really pleased to see you. They're novel experiences for an MP. But actually the valuable practice of just, speaking to staff in particular, and just hearing how things are going and experiencing it myself, it's very valuable to me. But, I understand that people have concerns about the roles that MPs take.
That was Maria Caulfield, the Health Minister, speaking to me about what it's like for GPs right now, but also her work in the NHS.